Co-occurring disorders with borderline personality disorder, BPD, depression, anxiety, eating disorders, substance abuse. Borderline personality disorder, BPD, is a complex condition that often does not exist in isolation. Many individuals with BPD also struggle with co-occurring disorders, which are additional mental health conditions that manifest alongside BPD. These co-occurring disorders, such as depression, anxiety, eating disorders, and substance abuse, can complicate diagnosis and treatment, but understanding their relationship with BPD is crucial for effective intervention and support. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore some of the most common co-occurring disorders with BPD, how they impact the individual, and strategies for managing these complex conditions. 1. Depression and BPD. Depression is one of the most common co-occurring disorders with BPD. Individuals with BPD often experience episodes of deep sadness, hopelessness, and low self-worth, which are key features of depression. Depression in BPD is often exacerbated by intense emotional dysregulation and difficulties in interpersonal relationships. It is important to recognize that depression in individuals with BPD is not just a result of feeling down about life situations, but can also stem from emotional pain triggered by a perceived abandonment, conflict, or personal failure. How depression affects BPD. 1. Emotional instability. The feelings of emptiness and hopelessness that come with depression often magnify the emotional instability of BPD, leading to increased emotional reactivity and more intense reactions to perceived rejections or losses. 2. Impaired functioning. Depression can further impair the ability to function in daily life, making it harder for individuals with BPD to manage their emotions or maintain healthy relationships. It may contribute to more social withdrawal, lack of motivation, or excessive rumination. 3. Increased risk of self-harm. Depression often contributes to feelings of worthlessness and despair, which can increase the likelihood of self-harm or suicidal ideation, both of which are common in individuals with BPD. Managing depression in BPD. Psychotherapy, cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, are both effective for treating depression in individuals with BPD. CBT helps individuals challenge negative thought patterns, while DBT focuses on developing emotion regulation and distress tolerance skills. Medication, antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, can be useful for treating depression and its symptoms. However, medication should be used as part of a comprehensive treatment plan alongside therapy. 2. Anxiety and BPD. Anxiety disorders, particularly generalized anxiety disorder, GAD, panic disorder, and social anxiety, are often present in individuals with BPD. Anxiety in BPD is closely related to the fear of abandonment and rejection, which can cause overwhelming distress. Individuals with BPD may experience constant worry, overthinking, and hypervigilance, which intensify the emotional instability and impulsivity that are already present in the disorder. How anxiety affects BPD. 1. Fear of abandonment. Anxiety often arises from the anticipation of abandonment or rejection. Individuals with BPD may excessively worry about their relationships or expect others to leave them, which can increase emotional volatility. 2. Social difficulties. Anxiety, particularly social anxiety, can make it difficult for individuals with BPD to engage in social situations, leading to isolation and avoidance behaviors. 3. Increased impulsivity. When individuals with BPD feel overwhelmed by anxiety, they may engage in impulsive behaviors such as substance use, self-harm, or reckless actions to manage the distress. Managing anxiety and BPD. Mindfulness-based interventions. Mindfulness practices, such as those taught in DBT, can help individuals with BPD reduce anxiety by promoting present moment awareness and reducing rumination. Exposure therapy. Exposure therapy can be effective for social anxiety and specific fears, helping individuals with BPD gradually face situations they find stressful while learning to manage anxiety in a controlled way. Medication. Medications such as SSRIs and benzodiazepines, short-term, can help reduce anxiety symptoms, though they should be carefully managed under a doctor's guidance. 3. Eating disorders and BPD. Eating disorders, such as bulimia nervosa, anorexia nervosa, and binge eating disorder, frequently co-occur with BPD. These disorders are often a form of self-regulation gone awry, where the individual attempts to manage overwhelming emotions or feelings of emptiness through control over food or eating behaviors. Individuals with BPD may struggle with body image issues, impulsivity, and a desire for control, all of which contribute to the development and perpetuation of eating disorders. How eating disorders affect BPD. 1. Emotional regulation. Eating disorders can be a way for individuals to temporarily manage emotional pain, anxiety, or depression. However, the relief is short-lived, and the behavior often leads to more guilt, shame, and physical health issues. 2. Body image issues. Many individuals with BPD have distorted body image and may turn to disordered eating as a way of gaining control over their appearance and self-worth. 3. Impulsivity. Impulsive behaviors, such as binge eating or purging, are common in individuals with BPD. These actions may serve as a coping mechanism for overwhelming emotions but lead to long-term physical and emotional harm. Managing eating disorders in BPD. Integrated treatment, a combination of DBT and eating disorder-specific therapy, such as cognitive behavioral therapy for eating disorders, or CBTE, is often the most effective way to treat both BPD and the eating disorder. Psychiatric support, medical treatment for eating disorders, including nutrition counseling, medical monitoring, and therapy, is crucial to address the physical consequences of disordered eating. 4. Substance abuse and BPD. Substance abuse is another common co-occurring disorder in individuals with BPD. The impulsivity, emotional instability, and need for instant gratification seen in BPD often lead individuals to turn to alcohol, drugs, or other addictive behaviors to cope with their intense emotions. Substance use provides temporary relief from emotional pain but ultimately exacerbates the symptoms of BPD, leading to a cycle of self-destructive behavior and addiction. How substance abuse affects BPD. 1. Escalation of impulsivity. The impulsive behaviors associated with BPD are often amplified by substance use, leading to risky behaviors, reckless driving, unprotected sex, or criminal activity. 2. Escaping emotional pain. Individuals with BPD may use substances to numb emotional pain or to cope with feelings of emptiness or shame. However, substance use often worsens the symptoms of BPD and increases the risk of self-harm or suicide. 3. Compromised treatment. Substance abuse can interfere with the effectiveness of therapy and medication, as it undermines the ability to regulate emotions and process trauma. Managing substance abuse in BPD. Dual diagnosis treatment. Effective treatment for BPD and substance abuse requires an integrated approach that addresses both conditions simultaneously. This typically includes CBT, DBT, and 12-step programs, such as Alcoholics Anonymous, alongside specialized treatment for addiction. Support groups. In addition to therapy, support groups specifically for individuals with both BPD and substance abuse issues can provide a safe, non-judgmental space for individuals to share their experiences and receive encouragement from others who understand their struggles. Conclusion. Co-occurring disorders such as depression, anxiety, eating disorders, and substance abuse are common in individuals with borderline personality disorder, BPD, and these additional challenges can complicate diagnosis and treatment. Understanding the relationship between BPD and these co-occurring conditions is crucial for developing effective treatment plans that address the full spectrum of the individual's emotional and behavioral needs. Treatment approaches that incorporate psychotherapy, medication, and holistic care are essential for helping individuals with BPD and co-occurring disorders manage their emotions, reduce impulsivity, and improve their overall functioning. With the right support and resources, individuals with BPD can work toward emotional stability, healthier coping strategies, and a more fulfilling life. In future episodes, we will continue to explore additional aspects of BPD treatment, offering insights into how co-occurring disorders can be addressed and managed effectively. Stay tuned for more on borderline personality disorder and its complexities.